happiness. I hope so. This particular session will give you some advancement in biomedical engineering. Wherever I need to give a talk about it, I am very enthusiastic about the talking about the biomedical because I'm total passionate towards biomedical engineering for the past 20 years. I'm there in the field for the biomedical engineering for services. So here, in this particular as my ma'am called me 1 week back, she was supposed to tell me to talk about some recent trends and opportunities, job opportunities. So that is what that is very efficient topic, and so it is most useful for especially those who are all in the final years. Okay, that is what I said. Accepting, ma'am, no problem like that. But unfortunately, we have some of the technical. I'm sorry, we have some of the official work. That is why I apologize, ma'am, for half an hour delay for this particular session. I hope so. This particular session can able to extend up to 1 hour. What is the time management I need to follow is I am just going to give some of the introduction about how the particular healthcare biomedical engineering is. And of course, even though you know about what is biomedical engineering even better than me, but it's my duty to give some of the introduction about because whenever you go given any Tamil speech, we are starting with Trikural, right? So that's what it's like as a biomedical engineering. In my point of view, biomedical engineering is also a language for me. So just give some of the small introduction about the biomedical engineering concepts, and then I just move into the how far this biomedical engineering is so important. Everyone knows that the biomedical engineering is so important. Everyone is rushing towards to entering into the engineering seats. Every colleges, even some of the colleges, no, some of the colleges in Chennai and some of the colleges in Bangalore, they are having the count of the students only in the biomedical department. Then another department they are having a limited count. That is what happened because of the some other reasons. I will tell you what is the reason behind that is. So that is the main thing. I need to share something about biomedical engineering first of all, and how this particular biomedical. You need to know about the depth of the biomedical engineering. This is the God's grace for all the people who are studying biomedical engineering apart from other department. That is what I need to prove and you some other with some other examples. Okay, and then I will move into the some of the recent trends, available in job market because in the 2020-21 period, because of this pandemic period, the FDA does not receive much amount of proposal to send into the market. Limited amount of equipments only come into the market for this particular pandemic situation. Even though I will share you before that what has happened nowadays. Also, the particular trend is changing. How far the radiology imaging is changing, and all the things we will discuss then. And finally, I have to give something about the job scopes. Of course, what are all the job scopes are available. And once you are finishing this particular, because can you please put if you want to say anything, please unmute yourself and open your mouth and say because I can't able to see the chat box and all because somebody of them message me through the chat box. If you have any clarifications or any time, you can unmute yourself and you can say anything. Okay, right? That's what. So that is the today's plan actually I have. So first of all, I need to say something about biomedical engineering. So biomedical engineering, of course, you are all well known about. It is something related. Everyone says that it is nothing but the bridge between the electronics and the medical. It is a bridge between the engineering and the engineering and the hospital, engineering and the healthcare like that. See, in my point of view, without biomedical engineering, even the doctors are not possible to diagnose some of the diseases to the patients because doctor is also a human being. Please remember, doctors are also a human being. They are not having a much amount of clarity, or not, they are having not much amount of God's eyes to see the internal organs of the human body. At the same time, without any equipment, for example, even a small temperature the particular person have. For example, you have some of the temperature. Everyone knows that once you touch the person, we can also resemble that the particular person have some of the high temperature like that. But what is the reason why we are going for the clinics for checking the temperature and all? For the doctor also, he just checked the particular person's hands and particular person's chin and all. He felt that some of the temperature arising in your human body like that. Then next step what he need to do is he takes one of the device that is called a thermometer. So without the thermometer, what is the need of using the thermometer? The particular thermometer shows the exact reading what the particular person have. What is the exact temperature what the particular person have. So without temperature, what happened? Even the doctors also says that, yes, man, you have a temperature. Now that is the thing we also know, no. So even a small temperature, without the temperature, the doctor couldn't find out what is the exact reading of the person. Like that, there are over so many devices are there. Without any devices, there is no multi-specialty hospital in my point of view. How we can able to divide the hospitals, right? Clinics, small hospitals, major hospitals, and multi-specialty hospital, government hospital, like that. In that, the high point is multi-specialty hospitals. What is the difference between all this thing is all the kind of facilities are available in multi-specialty hospital. The facility, especially, it is pointing out the medical equipment. So that is what we are improving the strategy of the healthcare, most probably, man. We are improving the strategy of the that is in the healthcare. I couldn't say without the doctor, healthcare can able to develop, not like that. Doctor is also required in healthcare. At the same time, along with that, biomedical engineer is also should be there along with that. Join hands only we can give any sort of the treatment to the patients, and we can able to find out any sort of the diseases from the patients. So that is the most important thing, man, you need to know about it. So now currently we have almost as per the FDA approval, as per the FDA report, almost 15,000 biomedical equipments are there. 15,000 biomedical equipment. Just think about it. We just go for the automobile, just go for the electrical, and just go for the electronics companies. What they did, they are doing some of the home appliances. They are doing some of the joyful equipments like the automobiles, like cars and the scooters, motors, and everything. So this is not at all correlated with your human health. The only engineering department that will exactly relating your human health is the biomedical. There is no other engineering department. You can able to say, sir, electronics is also there in the biomedical equipment. Electrical is also there in the biomedical equipment. Biotechnology is also there in some of the biomedical research. And why would you say only the engineering department? See, what I need to say, what you need to note down is, can you please mute yourself? Somebody have them on the mic, I think so. So sorry for the interrupt. Yeah. So what is the main thing you need to note about is 100%. See, electrical importance is also required. Electrical engineering concept is also required for framing the biomedical equipment. Biotechnology, some concepts, the nanotechnology level thing is also required to do some of the biomedical research. Of course, mechanical is also requiring for preparing some of the models and all. All the thing is okay, but bit of that. எப்படி சொல்லலாம்னா in Tamil we can able to say ஊறுகாய் மாதிரி, சாப்பாட்டுக்கு ஊறுகாய் மாதிரி நம்ம தொட்டுக்கிடலாம். பட் சாப்பாடு அப்படின்றது, that food அப்படின்றது, the full and whole hardcore, the 100%, the total equipment is involving in the healthcare is the only biomedical engineering. So you know about the depth of that. Many of the biomedical engineering people know. So many of the some biomedical engineering people, some other institution, I hope so. You people also have some of the negative thoughts in their mind. Negative thoughts in their mind. What is that? Is biomedical படிச்சா வேலை கிடைக்க மாட்டேது, biomedical கிடைச்சா யாரும் வேலைக்கு போக மாட்டாங்க, biomedical படிக்கவே வேண்டாமா, இதுக்கு ஸ்கோப் இருக்கா இல்லையா, whether the particular job the domain have any scopes or not. So these kind of the impacts created by many of the institutions, most of the students, whether they are coming for their training, they are all asking about, sir, இதுக்கு ஸ்கோப் இருக்கா இல்லையா சார், போகலாமா மாட்டோம். Don't worry about it, because I am in the field. We are having more amount of research on biomedical engineering, job scopes, and what is the vacancies, and how far we can able to targeting the tier 1, tier 2 company. All the things you need to plan by yourself, because don't trusting on the negative impacts of over it. Because in my point of view, the job is open for everybody, especially for the bio. Still, the vacancy is there, because we are having the training institute weekly, thrice or weekly 4 times. Some of the companies called us, and they just ask us, any of the students are there, sir? They are those who are finishing the training and those who are finishing the final year. Can you please send them for the service, send them for the application, like that. The most important thing is, don't trust the negative thoughts first of all. Then only the outcoming the 1.5 hours should be useful for you. Vacancy is there, but the thing is, you are not search the healthcare, the biomedical vacancies through the net. That is the most important thing you need to note. Don't search the biomedical engineering jobs through the net. What the particular normal graduated person did, they just type in the Google biomedical jobs like that. Then once you are putting that, type the biomedical job vacancies, in the 3 pages, in the 4 pages in the Google, they deliver only the biomedical coding. Please, my dear guys, biomedical coding is not at all related to the biomedical. That is a coding job. For if you want to move into the medical coding, there is no need of studying the biomedical engineering. That is my main point of view. So most of the in colleges and institution, whenever I gave the speech, I am totally arguing this particular medical coding is not at all related to the biomedical engineering. So that is what, if you are getting that particular thing now through the net, you are not able to get a proper job vacancies list. So what is the next thing we need to do? So how we can able to find out the jobs? So all the things I will tell you. At the same time, once you are going for the job seeking websites, for example, you can able to say Naukri is there, Monster is there, timesjobs.com is there. There are so many Quicker there. There are so many job seeking websites are also there. Somebody of them, because of the curiosity, they are straight away entering their profile, they are entering your photo, the resumes and everything they uploaded. What happened behind is that is we have some of the actually we are having some of the research how the job vacancies are finding out and what are the advantage we can able to get using the job seeking website to somebody else. We are connecting so many 1,000 to 2,000 people in around Chennai and in around South Tamil Nadu biomedical engineering students. Many of them says that I got the job not through the Naukri. 75%, 85% we can able to say we can't able to find exact vacancies through the Naukri or through the Times job or through the Monster or like that. So job seeking website is also not possible to get a job, to show the job vacancies clearly to the, especially the biomedical engineering, I would say. So that is the most important. You know what has happened in the US? If we have a chance to go there, and where my friend is working in a GA, so he says that in a GE biomedical company, in a GE headquarter there, and Johnson & Johnson is there, 65% of the employees, 65% of the employees are abroad candidates. 65% of the employees are abroad candidates. In the 65%, 35%, 35 to 36% are Indians. Please note out the point. 36% are the Indians. Then how they find out the vacancy? Don't think that sir, fresher couldn't able to move into the tier 1 company like that. Even in my knowledge, I can able to point out some of the people, those who are having a well knowledge on electronics and anatomy, they are got placed in Medtronic. The name is my student name is Lohapriya. He got placed in Medtronic. He doesn't have any experience in some other companies or some other hospitals. But he is having a well-equipped project and he is having an enough amount of knowledge on the electronics and the human anatomy behind it. So that is what he can able to get. She was getting to the Medtronic for the past 3 years. He is working. He's not having any experience behind it. So that is the main important thing, man. You would be finding out clearly the pathway. Job finding pathway is entirely different from some other domain to the biomedical engineering. The job finding domain is entirely different from other engineering domain. That is the one thing you need to clearly understand. What is the reason behind this? It is totally healthcare. All the equipment what you are using to the patient is totally healthcare related equipments. It is not just like an automobile. It is not நம்ம பொழுதுபோக்காக யூஸ் பண்ணக்கூடிய டிவி கிடையாது. It is not just a mobile phone. It is not just a car or some other like that. We are totally using to life saving the people. We are using this, even a minor equipment also. It is a life-saving equipment. For example, nowadays, because of the pandemic period, everyone searching about the pulse oximeter. Almost we published a pulse oximeter in 6 months back in the book. That book got totally published. Almost 2,500 books are sold out for this particular 6 months only. So just think about it. All the other person, I would like to ask the question, how many of them know about the pulse oximeter very clearly? How many of them know about the laws behind it? How many of them know about the importance of the infrared layer there, red light there, beer Lambert's law there, and what is the reason why the pulse oximeter is very important for this particular pandemic period. All these things, some of the ungraduated peoples also, or maybe some of the non-biomedical engineering peoples are also, they are start selling the pulse oximeter, man. For example, Ford, the famous automobile company, they start manufacturing some of the pulse oximeter for giving pulse oximeter to the healthcare market. And Tata, some of the other automobile companies are start manufacturing one more equipment that is called oxygen concentrator. Oxygen concentrators are much more devices. Of course, you are on the Coimbatore, well know about the situation, what has happened there. So that is also a biomedical device, no oxygen concentrator. So what is that as? So these kind of the knowledges, what is the trending actually? What has happened now in the market? That is the thing expecting. That is the thing actually the company people is expecting. We have a chance to meet some of the HR of the tier 1 companies, especially through the Logopriya. I met Medtronic HR and then GHR, and some of the companies we just pointed out. We have some of the chat with them. What they say is all the universities, all the institution peoples that are passing out from the engineering, they are having much amount of knowledge theoretically, but they are no having any knowledge about practical experience, how the particular equipment is used. Or in case if you are dismantling, it is not the particular persons are not able to dismantling the particular equipment, then what is the present inside the particular equipment? See, pulse oximeter is used to finding out the oxygen saturation of the human body. This is the common point everybody would know. But as a biomedical engineer, along with that particular point, you need to know about how the particular pulse oximeter is functioning. The pulse oximeter is a rate of around 1,500 to 2,500 only. Join the 2 to 3 members, join yourself and get a money and get a pulse oximeter and try to sit in the lab or try to sit in your home or whatever it may be with the precautions and just dismantle that and just see what has happened there. What is TFT? What is the board they are using there? And how the particular penetration, how the detector is functioning. So all the thing, it is a possibility to learn about these kind of the knowledge only the HR people is expecting. But I don't know about what has happened in the lab of the Ramakrishna Engineering College, but some of the college they did know, they're just giving the analysis part only. So that is my kind request, my dear guys. If you want to searching job, you should have some of the qualities behind it. You should have some of the qualities of how the particular equipment is functioning. What is the particular equipment? That is not a matter, but how the particular equipment is giving the output like this. So that is the expectations all the HR is required. So what we need to do, that I will tell you. Then, so this is the way you need to understand about. Without the biomedical engineering, in 1895, Ranjit introduced X-ray. The initial part of the X-ray, no, it is the whole part. It will accommodate almost the whole room of this. But now, in the dental X-ray, Carestream is a company. They introduced the small chip that is called RVG, capital R, capital V, capital G. That is called a radiovisiography. What the particular X-ray, the post-processing works. The post-processing works will be done by, it is very difficult actually in the analog kind of radiology. We need to develop the particular fluorescent screen. We need to develop the particular thing for almost in a dark room, and then only we can able to see the particular image through the bright light like that. And then digitalizing is coming. Now, recently, RVG, of course, it is introduced in 2012 onwards, but many of the dental hospital I can't able to see in South Tamil Nadu. In Coimbatore also I visited some of the hospital. They doesn't have any RVG. So that RVG is most important. What is the RVG did is, of course, you are all the biomedical engineering people, especially third year and final year people. You are all well known about the image intensifier. Image intensifier is especially used for the post-processing work of the X-ray. Once the X-ray is penetrating the human body, all the radiations are converted into the electrons by means of the photocathode in the image intensifier. The image intensifier size is almost, it is around, it's just like a small table. Okay, all the things present behind the patient's body, and then next to the detector we have the cassettes, X-ray cassettes. In many of the hospitals now also they are using. Don't avoid that. New digital X-ray தான் நம்ம கத்துக்கணும் அப்படின்றதெல்லாம் இல்லை. Inno 30%, 40% of the government hospitals, still they are using the analog X-ray only. So that is also our job to learn about the past X-ray. So அந்த மாதிரி எல்லாம் இருக்கிறது. இப்போ இருக்கிற development, now the development is the small RVG, the small chip-like man, the small chip-like structure. What the particular thing is did is, what the whole big sized image intensifier did, the small RVG did the function. The RVG is a small device, the small sensor. We need to keep the particular thing in your mouth. Wherever you need to take the image, using the cone beam X-ray, you need to pass the X radiations to this particular region. You are placing your RVG behind the teeth. Okay, then RVG, what it did is, or whatever the functionality the image intensifier did, all the functionality is done by the RVG, because the RVG consists of 9 different layers. Very, very minimum AI technology. Each and every layers are very minimum. It is like very simple only. Okay, it's like very simple. I will show you. Bashir, please take the RVG. So I will show you. Okay, so that particular chip, we need to keep that particular thing inside the mouth, and we can able to take, once you are passing the X-ray beam, all the 9 layers will converting the radiations into electrons. It will digitalizing, all the thing happen. Then at the back side of the RVG, we have the small cable. That cable is connected to the laptop. And straight away we are looking within a fraction of second, we are looking the particular image very clearly in the laptop. That is what the technology is. But these are all the things not available in Kanpur book. These are all the things not available in the Armugam book or Ku book or whatever it may be. So that is an advanced thing. That is, at the same time, this is not the fault of the institution. This is the fault of ourselves. We need to search what is an update available in the FDA. Weekly once you have a weekly once you have a hobby, you need to look over the FDA website. Okay, FDA website, you need to look over it. In that, medical devices option is there. You just look over whichever are the equipment now published to the market. Like that, you look on that each and every week. Through that, you can able to develop yourself, because everybody having an Android mobile nowadays, right? So the world is with you. So through that, we can able to identify the recent technology of the biomedical. That is the most important thing, because as per our research, within 1 month, 15 to 20 biomedical equipments are approved by the FDA in all over the world. But still we are studying about, still we are knowing about that particular thing also. What is that particular 15 equipments are announced? So these are all the things you need to work it out yourself. Once you are working all these condition process, then automatically you get the optimistic nature. The pessimistic nature will be shut down automatically with you, automatically from you. Full of optimistic knowledge you have. So this is the way you need to work it out before searching the job. Okay, RVG card. So I will show you. This is the RVG, right? You can able to see. This is the small chip, man. This is a small chip we are. This is in the back side we are having the small cable. In this RVG, this particular RVG consists of 9 different layers. See the size of that? I hope so you can able to see the small size. This is introduced by the Carestream company. Carestream, one of the dental company, leading dental company. This particular thing, it is most useful. We need to keep that particular thing, open your mouth, and wherever the wherever the area the doctor is suggesting you to take the image, you need to keep the particular thing to the mouth itself. It should not. It should not be give any shock to you also. That is the technology you need. Like that. Not only this. Like that, there are so many other devices also there to know about it. You know, DOSI. DOSI is the new invention. Actually, it is not a new invention. 4 to 5 years back itself, it is announced. But still, there is no advancement in the books of the engineering people. So that is what this is the duty of ours to know about it, man. That is my kind request is that DOSI. What is DOSI? What is breathalyzer? Breathalyzer is a new technology machine. What is that? What is a proton therapy? The proton therapy, you know, what is about know about the, I will show you some of the slides through the presentation. Okay, so this is what the technology. Once you know about the recent technology in back of you, then that may give you the clear idea about how we can able to search the job. Thank you, Bashir. So how we can able to search the job? That is the most important thing you need to finding out. Okay, so I hope so you can clearly understanding about the biomedical engineering depth knowledge, depth of the biomedical engineering. Also, because if you want to say about biomedical engineering, I can able to talk almost 2 to 3 days, but it is a limited time. Lavanya madam says that we need to winding up with 1 o'clock because you are having some of the placements classes. So straight away I move into the today's topic. So each and every one, once you are before searching the job, you need to know about the depth of the biomedical engineering very clearly. That is the most. It is not as just like an IT job. It is not just like an automobile job. It is not just like a wireless communication job. It is a totally different job from that. So you need to know about it. You need to know clearly about it. Of course, you are having a much more count of seniors members. Senior members are there, and I hope everyone, somebody of them there in the Tier 1 company. I hope so, because you are all நீங்களாம் வந்து ராமகிருஷ்ணான்றது 2007ல இருந்தே இருக்கும்னு நினைக்கிறேன். I think so. So this is the way you can able to find out. Okay, straight away I just want to move into the sharing my slides. Okay, very good, thank you. I will share my screen now. You can able to clearly finding out, because I am having a bad experience to using this WebEx, so I'm sorry for that. So screen share, share content, okay. Share content or share screen? Share content, right? Yes. It's okay or not? Screen option, I click that. Sorry, excuse me. Yeah, wait a minute. Share my screen. First of all, healthcare technology. Yes. So, madam, you can able to see my screen now? Anyone response, please?
No, sir.
Oh, what has happened? Oh, what has happened? Because I have a bad experience to using WebEx. It's the first time I'm using WebEx now. Share screen. Settings there. Settings. You want to know about the settings on? Yes. How it can able to show, I think so. Yeah. But I'm sorry again. You can see my slide now, actually, at least.
No, sir. Sir, I have given the rights to you, sir, presenter rights to you. So just click on the
Yeah.
share content and it will be open, sir.
Yeah, that is the same thing I did actually, but
Can you try
wait a
for
minute.
once?
Wait a minute. Sorry for the interruption. I will do it very fastly. Very good. Thank you. Share screen, device settings. Okay, share screen. Allow. Yes. Now I got it. WebEx start capturing everything displayed on your screen. Yes. Okay. Don't show it again. Yes. Okay. Then okay now. Now I think so. It is okay. Most probably now it is okay. I think so, ma'am. Good reply.
Yes, sir.
Yeah, thank you very much. I'm sorry, guys. Sorry for the inconvenience, because I have a bad experience of using WebEx. That is why. So So now what I'm going to say is, ma'am, it is okay, ma'am. It is okay for you. The what is the session passing the half an hour? Okay, yeah.
Yes, sir. Yes, sir.
Okay, thank you, madam. So healthcare in modern, because I don't want to get bored. That is what. So healthcare in modern technology, we are limiting of time only for 50 minutes are available. We need to share the two different types of presentation. So healthcare in modern technology, I straight away move into it. Presenting. Yeah. So healthcare, of course, you are all well known about it. The healthcare, it includes the doctors, nurses, pharmacists, and biological engineers, of course. So most importantly, this is the point I already shared you. So in that healthcare, now we are in the modern healthcare technology. In my point of view, we are in the modern engineering modern healthcare technology only because of the reason of biomedical engineers. Because the development, what the doctor studied in 2000 years back, or what the doctor studies in 1000 years back, the same human organs. If there is any changes in the human organ, what is the heart functioning in the 1500 years back human being, the same function did by the nowadays. Okay, there is no changes in the organ function, there is no changes in the structure. So the doctors is going to study what they studied in the 1000 years back. Advancement, we can able to say deeply they are going to study about the organs and all, but the development, the healthcare, the modern technology development is only because of the biomedical engineers, not for the doctors, not for the pharmacists, not for the nurses. But pharmacists, we can able to add, they are inventing some of the new tablets. They are providing some of the tablets for unpredictable diseases. Of course, I acceptable. But the thing is, the development, each and every day development is done by the biomedical engineers. That is the depth point you need to know about it. Okay. So that is what the healthcare development is mostly because of the biomedical engineers. Through this biomedical engineers only, everyone is getting benefited, especially doctors and the patients. Without biomedical engineers, I would like to say there is no healthcare in nowadays. That is the most important thing you need to know about it. Okay, and then we want to move to the next slide. Firstly, I will rush it out. So next we can able to pointing out now. In of course, almost in the year of 2020-21 academic year, once you go and visit the particular FDA website, we have the report. We have in the newsletter, they just pointing out there are over 15,000 biomedical equipments are there. Is it is possible for you to learn about all these 15,000 biomedical engineering biomedical equipment in 4 years? Not. It is not possible, because we have to know about some of the basics of the biomedical engineering. First of all, what is electronics and what is anatomy? Anatomy is play a main vital role, man. Please remember, that is the only thing we make a difference between the electrical electronics people and the biomedical engineers. Don't keep that particular anatomy in the second year only. Keep that particular anatomy till your end, because anatomy is the most important one. For example, if you go and selling some of the equipment to the doctors, we are not supposed to approach the particular equipment to the doctor in the electronic manner, in the electrical manner. We are supposed to selling the particular equipment. We are approaching the doctor in the way of anatomically only. Anatomically only we can able to approach the particular doctors to selling the machine. At the same time for the service, at the same time for the application, because the doctors have a bad knowledge on the electronics. They know only about the anatomy. So if you want to selling the equipment, or if you want to go as an application specialist, the most important thing is you should know about the anatomy very clearly. So that is the most important thing. So all the basic units to cover in the engineering studies, and then only you can able to go for the equipment. So learning of basics is also not possible to learn all the basics in the biomedical engineering for the past 4 years. But then how it is possible to learn about 15,000 biomedical equipment? That is the most important point that every biomedical engineer should know, especially for the second year people, I would like to say. So how we can able to know about that? We can able to divide the particular biomedical equipment into the three different categories. So yesterday I made some of the video, because many of them asked this particular thing. So yesterday I made some of the video. I think Santosh Kumar know about it, because I posted in the LinkedIn. That particular video I clearly telling about how we can able to learn the biomedical equipment, because 15,000 equipment is not possible. So then how we can able to learn? How we can able to learn the equipment? Through that, how we can able to get the job? That particular thing, you need to divide the equipment into three different categories. So that three different category includes the trending equipment and job scopeful equipment and the next gather scopeful equipment. What this mean is actually trending equipment means that in this particular period means that not this 1 month or not this 2 months, within a 1 year, in this 1 year or 1.5 year, which one is trending? Of course, you are all well known about it. Respiratory devices is very trending nowadays. Okay, so the respiratory devices is most important to learn first of all. Okay, even though you are not studied in the book, even though you don't have any basics on the particular but know about the particular equipment, just Google it and finding out what the particular equipment is needed for nowadays in very critical situation. Then if it is possible, get that particular equipment, or as the frame some of the 10 members grouply, and then get the particular equipment and then know about it. So that is the way. So we can able to point it out oxygen concentrated, and we can able to point it out the ventilators. We can able to point it out pulse oximeter, nebulizer. These are all the 4 different equipment now, a trending equipment actually. Even an ungraduated people are also trying to know about this particular equipment. But why not the biomedical engineers can able to know about it? So this 4 equipments is a trending equipment nowadays. It may be the trending equipment may be changed in 2025 or 2026. So in that particular period, which is a trending equipment? Once if you are studying the biomedical engineering in 2025, then you need to analyze, you need to categorize it as what is the trending equipment on that period. So once you know about the trending equipment deeply you know about the trending equipment, and please don't disturb the academic. Academic is keep on going on. Because of this, your academic should not be disturbed. Academics is also going on with an extra time you need to take spend for learning of this particular trending equipment. And then the second category is scopeful equipment. What is the meaning why I'm pointing out the name is scopeful equipment means whenever you are studying, whenever you know about the equipment, that particular equipment will give you job for any time else. ஸோ அந்த எக்யூப்மெண்ட் நம்ம லேர்ன் பண்ணிக்கிட்டோம் அப்படின்னா எப்பயுமே அதுல ஜாப் மார்க்கெட்டுக்கு நமக்கு ஜாப் இருக்கும் அப்படின்ற மாதிரி சில எக்யூப்மெண்ட்ஸ் நம்ம பாயிண்ட் அவுட் பண்ணணும். ஸோ அந்த மாதிரி எக்யூப்மெண்ட்டை பாயிண்ட் அவுட் பண்ணணும்னா we can able to pointing out some of the diagnostic radiological equipments. So diagnostic radiological equipments we can need to learn. For example, from the basics you started with the X-ray. X-ray இல்லாம எதுவுமே இல்லை. Without X-ray, modern technology is also not there. Okay, X-ray you need to know that, and then CT scan is need to know that, MRI scan you need to know that, especially portable ultrasound machine you need to know that. So once you are studying about all the trending equipment, then move into this particular equipment. Actually, the 4 different types of equipment. That is a diagnostic imaging equipment. Once you are clear about all this thing in the final year, then it is very comfortable. Then that will creating you confidence, man. That will creating you self-confidence. That will creating you to search the job very clearly in clear mind. You are not getting any pessimistic rumors from all around you. So that is the most important thing. If you have a chance, I share the particular thing to Lavanya madam or my dear Santosh Kumar. You can able to see that particular thing. What are the strategy we need to follow? Okay, we need to move into that, and then so. Of course, in the 2017 to 2019, clinics are shut down in India. 54% of clinics, of course, you know that the base level of the hospitals, the only one or 2 doctors there. The timing doctors are available in that particular clinic. Only you just go for the initial checkup if you're required. For example, for the blood pressure, for the blood pressure monitoring, or for the temperature reading measurement, or for something like if you have any allergies like that. Some of the small issues happens for the tincturing purpose, for the dressing purpose, you go for the clinics, right? So that kind of the clinics, no, the count of the clinics is shutting down. Because what is the reason behind it? Because of the biomedical engineering development. What is the biomedical engineering development? Because you know about, of course, final year students are know about the wearable systems. Wearable systems is the only reason all these kind of the clinics are shutting down. What is the reason behind? What is the reason we are going for the clinic? For the blood pressure measurement, for the temperature measurement, for the pulse measurement, for the dressing purpose, all the things. All the things are available in the home itself nowadays. All are home used equipment nowadays. Digital thermometer is there. When ungraduated people are also can able to use that particular thing. Now a thermogram is available. Then digital sphygmomanometer is there. Digital sphygmomanometer can able to use it by your mom or your grandfather also can able to use to find out his pressure very clearly. Even though it will give some of the it is not giving across that is accuracy, but even though you can able to know about the clearance of the X-ray. It gives some of the accuracy of 96% only. It will give accuracy, especially in the digital sphygmomanometer. But you can able to find out whether you're having a high BP or not. Like that, you can able to find out very predictably. Even though if you are feeling that you are having high BP, then you go for the hospital. So initial checkup, for the initial checkup, you need to know about by using this all wearable devices. The wearable watches is there. Wearable watches is also available to know about the pulse rate. So all these things are available in the home. All these things are available in the Amazon, Flipkart, and everything. Everyone can able to use the particular equipment strategy. So that is what there is no need of the clinics in the especially in the city sites. Okay, that is the most important thing. You know the development of that. Then we'll straight away move into the new recent technologies. Actually, these are all the things not a recent actually, but if you know about this, it is very appreciable. So proton therapy, of course, you know that IBA, the company is called IBA, ion beam application. Of course, many of them know about it. IBA, it is in European country, South European country. That particular IBA, especially in Netherlands, I think so. That ion beam application introducing this particular equipment called proton therapy. You know something? 2 years back, this particular equipment is available only in Chennai. In South Asia, you calculate. All around South Asia, the proton therapy is available only in Chennai Apollo Hospital. Somebody of the, if any of them from Chennai, they might not know about it. In Perungudi, I think so. In Perungudi and that area, the big construction is there. That particular thing is especially for IB application. That is for especially for proton therapy. What is the purpose of this proton therapy? Is what is the reason why they are not starting this, giving this particular equipment to all other multi-specialty hospital is it required 4 blocks. It required 4 blocks. How the four-floored construction is there, no? That kind of the construction is required. Of course, in many colleges, main block is there, no? The whole main block is required for adopting this particular equipment inside it. It is not as just like a linear accelerator. It is 50 times or 60 times bigger than that of that. It is a very biggest equipment. Okay, so thing is available only in that. Now Tata, you know, na? Tata start constructing this particular proton therapy in Mumbai, because Apollo registered many of the people coming from the Mumbai get treated from the using the proton therapy. So that is why Tata taking the responsibility to constructing this particular thing in the Mumbai. Okay, so that proton therapy, what it did actually, it will clearing the root level cancer. Please remember. Of course, there are so many equipments are there to clear the cancer, man. But what this proton therapy did is, this proton therapy clearing the root level cancer of the patient. Okay, that is the most important thing available. Of course, my friend, Mr. Rajagopal Krishnamurthy, is there in IBA, is there in a proton therapy unit in Perungudi. He says that if you want to get treated in this particular equipment, through this particular equipment, you need to pay 25 to 30 lakhs for the treatment. 20, whether it may be a what type of cancer it may be, except the blood cancer, except the bone marrow cancer, I think so. All the other cancer can be treated by using this particular proton therapy, but it is charged much more. Many of the Bollywood artists, many of the politicians, they are come and get treatment from this particular proton therapy unit in Chennai. So almost 200 to 250 patients are get treated and they got benefited. But the most important, some of the people from the Pakistan, some of the people from the Bangladesh, Afghanistan has also come there in Chennai get treated. But the most important thing is you are ready to spend 25 lakhs to 30 lakhs. So for a single person required 25 lakhs to 30 lakhs, then just think about the cost of the particular equipment. The cost of the particular equipment is much more, man. Okay, that is the most important thing. You just, if you have a time, if you have a any sort of the time, no, we need to talk something about proton therapy in some other. So in proton therapy or in a proton beam therapy, this particular time is a type of radiation treatment that uses a beam of protons to deliver radiations directly to the tumors. That is what that accelerator is there. The betatron, right? The accelerator is there. That accelerator will give some of the radiation. At the same time, those who are all working as a service engineer in that particular area, they are all maybe affected by the radiations. Okay, maybe affected by the radiation, because that is why they are not appointing some other peoples in the IBA. Straight away, they are appointing IBA employees to the Chennai unit. If you have a chance to go and visit, they are not, probably they are not allowing. If you have a chance, if I have got a chance, any of them interested, I just get a permission from Rajagopal Krishnamurthy, then we are just go and see. Most of the Netherlands peoples are there now, and at the same time, they are all IBA employees. Okay, that is what I need to share. So you need to know about this particular thing. Just look. Advanced radiation therapy with a treatment for the most comprehensive range of the cancer. Most whatever the cancer, except the bone cancer and except the blood cancer, all the type of the cancer can able to treat it at the root level by using this particular thing. Even though there are more number of cancer treatment equipment is available, this particular thing give much advantage to the patients. It should not be, the cancer should not be repeated for their hereditary also. So that's the most important thing they pointed out, especially Rajagopal Krishnamurthy shared by them, of course. Then the next technology, of course, I please remember that before I'm pointing out the laser recent technology in 2021 June and 2021 May, I listing pointing out some of the trending equipment there in the 2020-21 also, because many of the students, they might have know about bioprinting also. That is what I need to pointing out, because still now there is much amount of scope on that. Okay, bioprinting, of course, 70 to 75% of the human body organs can able to implant it. We can able to remove by using the artificial organs. That artificial organs, before once you are using the artificial organ to create the particular equipment, it takes time, and it gives some of the bad accuracy. For that particular purpose, the 3D printing is introduced to the healthcare in the name of bioprinting. Through the bioprinting, the accuracy rate is much more than that of the handmade artificial organ. So that is the very important thing you need to pointing out. What is the bioprinting is? What you see in the screen is an artificial ear. Artificial heart is possible. Artificial fingers are also possible. Artificial, all the other are bionic eye, bionic eye is also possible. So all this thing is possible by using this particular 3D printing. The equipment, the particular bioprinting, what it made is the most important. Which chemical we are supposed to use? If you want to replace the particular device into the human body, that you need to give some of the biomaterials. Or if you need to use some of the devices externally, fix some of the devices externally, then that may use some of the biomaterials along with some of the chemical. That is what you need to finding out. And that at the same time, in Coimbatore, there are so many 3D printing companies are there, I think so. 3D printing companies are much more in Coimbatore when compared to all other Tamil Nadu. Even though Chennai is not having much amount of 3D printing companies, but Coimbatore is having much amount of 3D printing companies. So if you have a chance, go on internship there and know about the bioprinting. Okay, that they are all people know about it, I think so. Bioprinters, printing with cells and biomaterials, creating organ-like structure. Okay, and then we move to the next important part, an artificial organ. An artificial organ play a main vital role. You need to know about the artificial organ. The most important thing is, what are all the thing I pointed out? It is not there in the syllabus. I hope so. I don't know about the Ramakrishna syllabus and all. I cross over some of the university syllabus. I couldn't finding out this kind of the technology in their syllabus framing. Even then, the elective also they don't have. I think so. I don't know. I'm sorry. It is maybe my statement is maybe harsh, but I'm not getting any clarity about the Ramakrishna syllabus and all. I don't mistake me. So artificial organs. If you have a chance to know about the artificial organs, keep on studying. If you are interested towards this artificial organ or bioprinting, what is the basics you know now? You need to concentrate more on biomechanics and biomaterials. Biomechanics and biomaterials, I think you are crossed over in the third year, I think so. So you must be strong on that particular two different subjects. Then it is most comfortable for you to learn about artificial organ. Okay, so just think that, man. I hope so you can know about the human anatomy of the eye. The most sensitive organ. The most sensitive organ in the human body is human eye. In my point of view, the world's best machine, everyone says. In my point of view, I am saying the world's best machine is a human body. some of the organ, no, if you go and know about the deep anatomy and deep physiology, it is amazed. It is amazed that each and every human being is actually wondering. So each and every organ functioning is also wondering. Of course, you know about the eye, rods and cones. Rods and cones did a major function. Nowadays we are talking about the detectors. Nowadays we are talking about the image intensifiers, RBG and all. No, all these things available in a human body itself, man. All the things, all the conversions are made. All the conversions are done in a human organ. The God made everything. So that is what I'm saying. The world's best machine is the human body. Okay, so artificial organ is the next technology you need to know about it. And then all these particular machines. For example, my kind request is if you are in the third year, start doing artificial organ projects, mini projects, and get that particular mini project into the major project also. Because many of the job sectors is open for these artificial organs. Most of the approval companies are welcoming you. Most of the funding agency also welcoming you to introducing this artificial organs to the healthcare. So that is what, if you have a chance, study about the biomechanics very deeply and then biomaterials very deeply, and straight away go and search some of the internet and just get some of the products and start developing some of the artificial organs. Okay, that is the most important thing. Some of the other organs are also not possible there in nowadays. So try yourself. Okay, so this is the US artificial organs in the biomechanics and in bionics organ. At the same time, artificial organs for the market size is also from the 2018 2027. Just think about it. You are in a final year or you are in a third year now. So the market of the artificial organ is keep on rising. See, in the 2027, it is almost organized 100% of the human organ can able to replace it. At the same time, nowadays, the one more technology, in the next slide, I will tell you. Along with that particular technology, this artificial organ, they start manufacturing some of the human body equipment in the research and development area. In the research and development area of some other companies, we can able to point out Siemens Healthineers, and we can able to point out the Fresenius Healthcare. These two particular companies that are tier one companies in US and Netherlands. These two companies, especially, they are doing some of the in the artificial organ research and development. The research and development sector, they are start manufacturing some of the artificial organ also. I got some of the news, but it is not into the market. But if you know about these kind of the thing, no, then it is very comfortable for you to entering into the Siemens Healthineers or Fresenius Healthcare. That is the most important thing. You need to work it out. So what the particular companies did, what the particular company is doing now, what they are doing, what are all the things, the vacancies available in outcoming years. That is the point you need to get from somebody else, and then work on it. And straight away, you are no need to apply to any other company. Straight away, you are just apply to that particular thing. I am well equipped in artificial organs. I am well equipped in biomechanics. I'm strong in biomechanics. Like that, you are just put it in the resume, and straight away they're just picking you for the salary of 1.75 lakhs or 2 lakhs as a fresher. So that is what the development is. You just please understand about the graphical improvement, especially for the artificial organ, is much more, man. Please remember. Okay, that is the point I need to note. And then we need to move into the healthcare robots. Of course, the Darwin C, you know that, and not a documentary Darwin C I'm not talking about. The Darwin C is nothing but the first lifetime robot. It's introduced in California in multi-specialty hospital. I'm not remembering that particular multi-specialty name. That particular Da Vinci robot did a major surgery in the operation theater without any help of the clinicians. This has also happened in the 2015-16, I think so. This particular robot did a major surgery. Nowadays, many of the robots are invented. The robotics is also healthcare robots I'm talking about. Healthcare robots are mechatronics people. They are having some of the projects through the robots and all. Take the particular robot in the healthcare. You just think about the healthcare. How we can able to use the technology into the healthcare. Like that, you can able to come into the market. That is the most important thing you need to know about healthcare market. See, remember, I just pointing out some of the technology only. If you want to talk about each and every technology, the 1 hour or 2 hours is not enough. I am just pointing out. நான் ஒரு ட்ரிகர் பண்றேன், இதை பத்தி தெரிஞ்சுக்கோங்க, இதை பத்தி நீங்க டீடைலா தெரியணும் அப்படின்னா you can able to go with your professors or your principals or HODs, whomever it may be, or you can able to contact me to know about detailed about that particular. I'm just pointing out it. உனக்கு எந்த ஏரியால இன்ட்ரெஸ்ட் இருக்கோ அந்த ஏரியால you just go and develop. That is the best way to search the job, man. Simply you are getting a 9.5 CGPA or 9.6 CGPA. I share one of the experience. Once I'm there in I'm working as assistant professor in some other college in Chennai. I have a chance to go as an external examiner at the project Viva. In that Viva, I just talked to one of the girl. One of the biomedical engineering faculty says, "Sir, she is very good, sir. She's got a 9.5 CGPA, 9.3 CGPA, sir. We are most probably, hopefully, this particular girl will get the university rank, sir. It will get much appreciation about this particular college will get move into that particular area. அது நல்ல டெவலப்மெண்ட்ல வரப்போகுது சார். மார்க்கெட்டிங்க்கு இந்த பொண்ணு அவ்வளவு நல்லா படிக்கும் சார், அந்த மாதிரி எல்லாம் சொன்னாங்க. ஓகே ஓகே, அஃப்கோர்ஸ் அகாடமிக்ல ரொம்ப ஸ்ட்ராங்கா இருக்கும் போல அப்படின்னு அந்த பொண்ணுட்ட ஜஸ்ட் ஆஸ்க், கேன் யூ பாயிண்டிங் அவுட் சம் ஆஃப் தி பயோமெடிக்கல் கம்பெனிஸ்மா அப்படின்னு கேட்டேன். She is not supposed to be frank, I'm saying, he can't able to say even a single company. She is not supposed to say pointing out any of the single. இது 2016 நடந்தது, 2016-17 நடந்தது. ஸோ அந்த பொண்ணுக்கு வந்து ஒரு கம்பெனி, என்ன கம்பெனி, பயோமெடிக்கல் கம்பெனி, டயர் 1 கம்பெனிஸ் இருக்கிறத கூட பாயிண்ட் அவுட் பண்ண முடியல. So that is what your academics is not. Academics is, of course, it is useful, but not only the academics is useful. Along with the academics, you need to work hard for your development in the future. That is the most important thing. What is என்ன நடக்குது உனக்கு முன்னாடி மார்க்கெட்ல, ஹெல்த் கேர் மார்க்கெட்ல என்ன நடக்குது, என்ன டெவலப்மெண்ட் வந்திருக்கு அப்படின்றத நம்ம பர்சனலைஸ் பண்ணி ஹார்ட் ஒர்க் பண்ணினா மட்டும்தான் we can able to flame in the future. That is what the most important thing. Lavanya madam, I'm sorry, just still 25 minutes long. I will rushing up. So medical robots allow surgeons to more dexterously and manipulate surgical instruments or catheters inside the patient's body during the minimally invasive surgeries. Okay, so most of the surgeries some of the surgeries can be done by the robots. Actually, it is not available in India. In my knowledge, some of the hospitals may have this, but most of the Western European countries, they are using this robot for the surgery also. That is also a proud moment for as a biomedical engineer. Then artificial intelligence. The intelligence word is missing actually. The slide size is very big. So artificial intelligence is the next terminology. I told you, one of the recent technology joined with the artificial organ. This is the technology. My kind request to all the biomedical engineers, those who are all coming for the training also, we would be say artificial intelligence is the future, man. Every biomedical engineers should know about this AI technology, because Google, of course, you are all well known about Google, Sundar Pichai. He start analyzing, he start doing the research to develop some of the medical equipment along with the artificial intelligence. I'm expecting 2022 and 2023, Google is straight away entering into the healthcare market to introducing some of the major equipment with the help of the artificial intelligence. So one clue இதான். ஸோ கூகுளில் என்டர் ஆகிறதுக்கு கூட நமக்கு வாய்ப்பு இருக்கும் இந்த விஷயங்கள் நமக்கு தெரிஞ்சதுன்னா. If you are expert in artificial intelligence, along with the biomechanics and artificial organ, then definitely you have a better chance to enter into the Google. GE-க்கும் ஜான்சன் அண்ட் ஜான்சனுக்கும் மெட்ரானிக்கும் சீமன்ஸ் ஹெல்த்தினியர்ஸ்க்கும் and then ஸ்ட்ரைக்கருக்கும் ஈக்குவலா they are start manufacturing all the biomedical products very soonly. Okay, all the process is going on. Okay, then of course, that is what my kind request is. Please know about the AI technology. Even though you are not having syllabus, you are not having this particular thing in the syllabus, try to learn this particular AI from other sector. So நீங்க ஃப்ரீயா இருக்கும்போது AI technology அப்படின்னா என்னன்றத விஷயத்தை நல்லா தெரிஞ்சுக்கோங்க. Maybe your IT faculty members are know about this. So AI technology நல்லா பேஸ் நல்லா தெரிஞ்சுக்கோங்க. Python programming also, it is very important for the கார்ப்பரேட்ல இருக்கிறதுனால நான் சொல்றேன். So Python programming is also outcoming programல 2023ல வந்து பாத்தீங்கன்னா அது இருந்தா தான் நீ பிளேஸ்மெண்ட்டே போக முடியும். அந்த AI technology, ML, machine learning and Python programming இதெல்லாம் இல்லைன்னா you are not supposed to entering into the healthcare. அந்த மாதிரி நிலைமைக்கு வரும் 2023-24 மார்க்கெட்ல. So that is what my kind request is. If it is not possible, if in the syllabus, try to advise the students to get them from the other sector or இந்த ஆன்லைன்ல நிறைய மோட்ஸ்லாம் இருக்கும், அதுல மூலியமா கத்துக்கலாம். ஏதாவது ஒரு செக்டார்ல ஏஐ பத்தி நிறைய விஷயங்கள் தெரிஞ்சுக்கோங்க. ஓகே, and then we move into the recent technologies. You can able to say that is the technology I need to point out. What you see in the right hand side now in my screen, that is called as a digital camera. Not is a digital camera actually. It is a digital dental X-ray. Digital dental X-ray. It is a cost of around 1.25 lakhs. Okay, it is a cost of around 1.25 lakhs. What it did is it just does like a camera. நம்ம எப்படி கேமரா எடுப்போம், ஒரு போட்டோல கேமரா எப்படி எடுப்போமோ அதே மாதிரி just a click. That's all. The radiations will send and it return back. The radiations will be stored in the image itself. Then straight away we can able to look out the patient's body. So that is what the development is, man. So development பாருங்க, நம்ம மேல டாப்ல போட்டிருக்கிறது அனலாக் எக்ஸ்ரே, அதுக்கு கீழே இருக்கிறது வந்து பாத்தீங்கன்னா மொபைல் எக்ஸ்ரே. தட் இஸ் த நெக்ஸ்ட் டெவலப்மெண்ட். தென் இப்ப இருக்கிற ரீசென்ட் டெவலப்மெண்ட் பாத்தீங்கன்னா டிஜிட்டல் எக்ஸ்ரே. இந்த டிஜிட்டல் எக்ஸ்ரே ஒரு கேமரா எடுத்து டப்புன்னு எடுத்துடலாம், அவ்வளவுதான். ஸோ அந்த மாதிரி டெவலப்மெண்ட் இருக்கு. எஸ்பெஷலி இட் இஸ் யூஸ்ட் இன் dental in nowadays, especially instead of cone beam X-ray, they are straight away using this particular thing. Okay, and then we move on to the, of course, they are all Ramakrishna Hospital is also there, I think so. So you have a know about all these kind of the equipment, bedside monitors, that is bedside ultrasound machine, portable ultrasound machine. The ultrasound development பாருங்களேன், பெட்சைட்ல இருந்தது, அதுக்கப்புறம் அதை போர்ட்டபிளா கொண்டு வந்தாங்க. தென் இப்போ மொபைல் போன்லயே we can able to take it out. தி மொபைல் போன் மாதிரி சின்ன ப்ரோப் தான், அந்த ப்ரோப் தான் ரொம்ப இம்பார்ட்டன்ட் அல்ட்ராசவுண்ட்ல. ஸோ இஃப் யூ ஆர் ஐ ஹோப் ஸோ கான்பூர் புக்ல யூ ஆர் சப்போஸ் டு ஸ்டடி தி பி ஸ்கேன், ஏ ஸ்கேன் அண்ட் எம் ஸ்கேன் மோட். That is most important in your future, man. You just please concentrate more on while you are studying that particular ultrasound. ஸோ அல்ட்ராசவுண்ட்ல வந்து பாத்தீங்கன்னா ப்ரோப் அப்படின்றது ரொம்ப இம்பார்ட்டன்டான ஒரு விஷயம். அதுல பீசோ எலக்ட்ரிக் கிறிஸ்டல் அப்படின்றது எப்படி யூஸ் ஆகுது, டிஃபரெண்ட் டைப்ஸ் ஆஃப் ப்ரோப்ஸ் ஆர் தேர். Convex probe, concave probe, and there are so many other probes are also there. Linear probe, and then you can a pencil probe is also there. So அந்த மாதிரி probe எல்லாம் என்ன ஃபங்க்ஷன் பண்ணுது, அந்த probe டைரக்டா மொபைல் போன்ல கனெக்ட் பண்ணிடுறாங்க. ஸ்ட்ரைட் அவே அந்த probe நம்ம வச்ச உடனே மொபைல் போன்ல you can able to view the internal organs. ஸோ அந்த மாதிரி ஒரு டெக்னாலஜியில we are in there in nowadays இப்போ படிச்சுட்டு இருக்கோம். ஸோ அப்போ how far you can able to get into a knowledge to face the market. That is what my kind request is. And then move into the wearable sectors. ஸோ ஐ டோல்ட் யூ நோ, நம்ம என்னெல்லாம் உடம்புல நம்மளால போட முடியுமோ, அது ஷர்ட்டா இருக்கலாம், அது பனியன்ஸா இருக்கலாம், இட் மே பி அ பெல்ட் ஆர் இட் மே பி அ பேங்கிள்ஸ் ஆர் இட் மே பி அ ஸ்பெக்டக்கிள்ஸ் ஆர் இட் மே பி அ ஷூஸ் ஆர் இட் மே பி அ சாக்ஸ், வாட் எவர் இட் மே பி, ஆல் த திங் இஸ் கனெக்டிங் டு தி ஹெல்த் கேர் நவடேஸ். எல்லாமே நம்ம என்னெல்லாம் போடுமோ, வளையல்ல இருந்து நகையில இருந்து, Holter monitor is there, no? Just like as an ID card, you can able to view the particular thing. You can able to get the ECG machine, ECG readings very clearly. அதை நம்ம போட்டுட்டு இசிஜி மிஷின் எடுக்கணும், நம்ம கிளினிக் தான் போகணும் இல்லையா? ஹோல்டர் மானிட்டர்னு ஒன்று வந்திருக்கு, நம்ம ஐடி கார்டு மாதிரி மேலே போட்டுக்கணும், அதுக்கு மேலே ஷர்ட்டை போட்டுக்கணும். ஆட்டோமேட்டிக்லி இட் வில் கண்டினியூஸ் மானிட்டரிங் will date. At the same time, that particular monitoring telemedicine மூலமா it will send the report to the doctors also. So if there is any abnormal condition, it will give alarm. So அந்த மாதிரி விஷயங்கள் எல்லாமே nowadays available there. So இதுதான் நியூ டெக்னாலஜி, நியூ டெவலப்மெண்ட், நியூ ஜாப் மார்க்கெட்டுக்கு தேவை. ஸோ இந்த மாதிரி விஷயங்கள் எல்லாமே that is happen in the market. Wearable devices, of course, all these parameters can able to finding out without any medical devices. This wearable devices will do all this function. It can able to measure the pulse, it can able to detect the motion of the particular person, orientation of your gait analysis. நீங்க இதுல படிச்சிருப்பீங்க பயோமெக்கானிக்ஸ்ல, gait analysis process, glucose, blood pressure monitor, oxygen saturation level, and the weight of the person, respiration rate, temperature, hydration, brain activity even, and then skin conductance. All the things can able to finding out using the wearable devices like. So that is what I need to pointing out one more graphical representation. The number of connected wearable devices worldwide. So please finding out this particular two graphs. What I did in the previous, what I shown in the previous slides, no? That is on graphical representation for the artificial organs. As like as the same as of in 2022, almost 1,105 equipments are available in the market. That is what I need to pointing out. Don't think that I need to rushing up. So breath analyzer. Breath analyzer is a recent 2020 FDA approved equipment breathalyzer. Through that, we can able to easily finding out your vital parameters. It is just a machine. It is just observing your respiratory tract. Respiratory tract means just observing your breath. Expiration அதை அப்சர்வ் பண்ணும். அதை அப்சர்வ் பண்ணி உங்களோட சரித்திரத்தையே சொல்லிடும். என்னன்னா வைட்டல் பேராமீட்டர்ஸ் அது மூலியமா how your heart rate is, how your breath rate is, whether you are having enough amount of oxygen in your human body or not. all the things will be displayed. So we have a chance, you just Google it and see it. Okay, and then we move into the, don't think that I'll rush you because we are running out of time. So glucose monitoring without skin pricks, how it is possible? Without skin pricks, how it is possible? Even though it is possible, how it give the accuracy? But FDA newsletter la போட்டிருக்கா, it will give 99% accuracy. So அப்ப இதை செக் பண்ணி பார்க்கலாம். So what is that and that? What is that particular instead of strips, how we can able to measure the blood glucose monitor? That is the things. See, and one more thing I need to note, FDA approving many of the equipment, of course. In that, 40% of the equipments are the students' project, man. Please, I need to note about this point. 40% of the approved equipments are the students' projects. But ரொம்ப வருத்தப்பட வேண்டிய விஷயம் என்ன அப்படின்னா, that are all mostly from the Europeans. ஐரோப்பியன்ஸ்ல படிக்கக்கூடிய ஸ்டூடெண்ட்ஸ் ஃபைனல் இயர் ப்ராஜெக்ட் தான் அவங்க ப்ரொபோசலா சப்மிட் பண்ணி FDA அதை அப்ரூவ் பண்றாங்க. இது வந்து ப்ரூவனான ரிப்போர்ட். ஸோ இது வந்து ஏன் வந்து நம்மளால பண்ண முடியல? Because we are all there in the tier 1 companies. Most of the Indians are there in the tier 1 companies. Then why not it is not possible for doing the well equipped projects? It is not available in the health market. So that is the most important thing we need to. Then headset for reviewing your chronic pains. Chronic pain அப்படின்றது 6 மாசத்துக்கு மேல நமக்கு ஒரே இடத்துல பெயின் இருந்ததால that is called a chronic pain. It is especially your brain neurons. Brain neuronsல ஏதாவது பிரச்சனை இருந்தனா most probably the Alzheimer's diseases, and then we can able to say some of the head injury diseases also there. We can able to finding out what has happened in the brain tissues and all for that through that particular equipment. And the smart lighting surgical applications. So ஆப்ரேஷன் இதுல என்ன ஒரு பெரிய விஷயம் கிடையாதுப்பா, ஆப்ரேஷன் தியேட்டர்ல இருக்கக்கூடிய பல்ப் தான். ஸோ இந்த பல்ப் என்ன பண்ணும் அப்படின்னா, நீ எந்த ஏரியாவுக்கு டார்கெட் பண்ணிக்கிறியோ, விச் இஸ் த ஏரியா த டாக்டர்ஸ் ரெக்வயர்ட் ஃபார் டார்கெட்டிங் டு டூ த சர்ஜரி, தட் த பர்டிகுலர் திங் வி கேன் ஏபிள் டு டூ இட் த்ரூ த ரிமோட். அண்ட் எந்த ஏரியான்றதை நம்ம வந்து என்டர் பண்ணிட்டோம் அப்படின்னா, நம்ம அந்த லைட்ஸை வந்து அந்த பக்கம் இந்த பக்கம் கொண்டு போகணுன்ற அவசியமே கிடையாது. ஸ்ட்ரைட் அவே த பர்டிகுலர் எக்யூப்மெண்ட் இஸ் மூவிங் டு தட் பர்டிகுலர் ஏரியா. ஜஸ்ட் திங்க் அபவுட் இட். பிஹைண்ட் தட் என்ன தெரியுமா? AI டெக்னாலஜி. ஸோ இந்த மாதிரி சில விஷயங்கள் எல்லாமே யூ ஜஸ்ட் ப்ளீஸ் நோட் இட் டவுன். சர்ஜிக்கல் லைட்டிங் ஃபார் சர்ஜிக்கல் அப்ளிகேஷன்ஸ், அண்ட் தென் வி வில் மூவ் டு தி டாக்டர்ஸ் இன்ஸ்ட்ருமெண்ட் டு த பேஷண்ட்ஸ் ஹேண்ட்ஸ். So whatever the doctor, because of these particular reasons also the clinics are shutting down. Okay, the doctor's instruments in the patient's hands. So all the vital parameters can able to predictably done in this particular equipment. அந்த phone மாதிரி flip phone மாதிரி இருக்கு இல்லையா, அந்த flip flop phone மாதிரி இருக்குல்ல, அதுல வந்து பாத்தீங்கன்னா ஃபர்ஸ்ட் எய்ட் பாக்ஸ், ஃபர்ஸ்ட் எய்ட் விஷயங்கள் எல்லாமே அதுல இருக்கும். ஈவன் ஃபர்ஸ்ட் எய்டுனா நீங்க அந்த டிஞ்சர் பண்றது அதெல்லாம் நினைச்சுக்கிட கூடாது. டீப்லி ஆர்கனைசிங், அதாவது டயக்னோஸ்டிக் இமேஜிங் இருக்கு இல்லையா, அந்த பர்டிகுலர் டிவைஸை இந்த மாதிரி ஒரு ஃபிளிப்ல ரெடி பண்ணி that particular probe will clearly showing you the internal organs what has happened. Even it having a capability to finding out the blocks of the heart also. So அந்த மாதிரி ஒரு டிவைஸ் எல்லாம் அப்ரூவ் பண்ணிருக்காங்க. And then so that is what I need to pointing out some of the third important graphical representation, that is global medical devices connectivity market by region in the USD billion. So just think about it. Just think about it. That is what இந்த கிராஃப் எல்லாம் அவங்க பார்த்து தான் நிறைய ஆட்டோமொபைல் கம்பெனிஸ், நிறைய வந்து வயர்லெஸ் கம்யூனிகேஷன் கம்பெனிஸ் எல்லாம் வந்து பாத்தீங்கன்னா they are coming to spend their money, they are start doing their funds towards the healthcare market. That is what I am saying. The good example Google is. Okay, so that is the main important thing I need to share. So these are all the things I need to share about the healthcare technology. Okay, now so first agenda is getting over. Now I need to, do you have any clarification regarding this? You can able to contact Lavanya ma'am. Through the Lavanya ma'am I can able to get, because of running out of time we are not spending. See, so the next thing we can able to move into it. The biomedical engineers, and especially I am going to talking about our second point of the title, that is recent trends. நான் cross பண்ணிட்டேன். Then இதுக்கு அப்புறமா நம்ம பார்க்க வேண்டியது job opportunities. So job opportunities அப்படின்றத I will tell you. Before you are searching for the job opportunities, no, you might have know about the job scopes and all. So job scopes வந்து பாத்தீங்கன்னா you just should have a clarity of the domain. So இப்போ வந்து இந்த job search பண்ண போறோம் அப்படின்னா, if you want to search the job, before searching the job you should clear about the domain. ஏதாவது ஜாப் கிடைச்சா போதும் நான் உள்ள போயிடுறேன், அது சேல்ஸா இருந்தாலும் பரவாயில்ல, சர்வீஸா இருந்தாலும் பரவாயில்ல, whether it may be application or whether it may be a testing and quality, whatever it may be, I want a job because of the family situation, I need to go for that. Don't do that. The thing is, once you are entering into the final year itself, you should be clear about the domain. I should go for sales. I should go for service. I should go for the research. Like that, you are just to decide in your mind and then search the job. And then just please working on the particular domain what you chosen for the last year. That is the most important thing you need to do it. Once you did it, then it is very comfortable for you to know about it. As a biomedical engineering, these are all the things we already discussed about. And then why electronics? Hospital equipment is full of electronics and electronic part. That is what we need to go about it. And then why anatomy is for, of course, if you want to selling the equipment or if you want to made an appointed as application specialist or whatever it may be, you need to, because நம்மளோட கஸ்டமர் யாரு? டாக்டர்ஸோட கஸ்டமர் பேஷண்ட், நம்மளோட கஸ்டமர்ஸ் டாக்டர்ஸ் தான். ஸோ அந்த டாக்டர்ஸ்ட்டு நம்ம எப்படி அப்ரோச் பண்ணணும்னா டாக்டர்ஸ்க்கு தெரிஞ்ச விஷயத்தை தான் நம்ம அப்ரோச் பண்ண முடியும். டாக்டர்ஸ் ஸ்ட்ராங் ஒன்லி அபவுட் அனாட்டமி தான். ஸோ அந்த அனாட்டமி அப்படின்றது ரொம்ப இம்பார்ட்டன்ட். Then, of course, total equipment, I already told you about 15,000 biomedical equipments are there in market. And we can able to categorize the particular equipment into the minor equipment, or it may be major equipment, or it may be a critical equipment. So, minor equipment, major equipment, critical equipment, அப்படின்னு பிரிக்கிறதுல ரெண்டு விஷயம் இருக்கு. என்ன அப்படின்னாக்க, first வந்து we can able to divide the equipment on the basis of the size of the equipment. Okay, we are not supposed to say வந்து ஒரு pulse oximeter வந்து நான் ஒரு minor equipment சொல்ல முடியாது. Pulse oximeter வந்து ஒரு basic equipment நம்ம சொல்ல முடியாது. Pulse oximeter is the most important critical care equipment. Okay, so according to the size or according to the price of the equipment or according to the usage of the equipment, so we can able to classify the equipment into the minor, major and critical. So இந்த மாதிரி விஷயங்கள் எதெல்லாம் மைனர்ல வரும், எதெல்லாம் மேஜர்ல வரும், அதெல்லாம் கிரிட்டிக்கல்ல வரும் அப்படின்றத you should be know about in the third year itself. Okay, then only it is very comfortable for you to know about it. And then our environment, of course, I told you, our total environment is healthcare. Our customer is one and only the doctors. Our customer is one and only the doctors. So please pointing out, you are going to meet the well graduated people in the society. You are not supposed to meet any ungraduated people. படிக்காத பையனை படிக்காதவங்களை போய் நம்ம பார்க்க போறது கிடையாது இல்லையா? ஒரு நிலம் விற்க போறது கிடையாது. நம்ம வந்து ஒரு ஹெல்த் கேர் எக்யூப்மெண்ட் விற்க போறோம். we need to sell the particular equipment to the high qualified people in the society. That is called doctors. ஸோ அவங்க தான் நம்மளோட கஸ்டமர். அப்போ நம்மளோட குவாலிட்டி எப்படி இருக்கணும் அப்படின்றது ஜஸ்ட் திங்க். ஓகே, அண்ட் தென் we have the, of course, these are all the thing. Of course, you are all well known about this thing. Of course, your faculty members are well known about this particular thing and all. அவங்க ஃபேக்கல்டி மெம்பர்ஸ் உங்களுக்கு நல்லாவே சொல்லியிருப்பாங்க இந்த விஷயங்கள் பற்றிலாம். பட் இட்ஸ் மை டியூட்டி டு சே ஜாப் ஸ்கோப்ஸ் அப்படின்றது 8 விதமான ஜாப் ஸ்கோப்ஸ் இருக்கு. ஸோ அந்த 8 டிஃப்ரெண்ட் ஜாப் ஸ்கோப்ஸ், திஸ் ஆர் த நீங்க 4th இயர் முடிச்ச உடனே இதுல ஏதோ ஒரு இடத்துல தான் யூ ஆர் சப்போஸ் டு பிளேஸ் தேர். ஓகே, சேல்ஸ் பயோமெடிக்கல் இன்ஜினியர், சர்வீஸ் பயோமெடிக்கல் இன்ஜினியர், அப்ளிகேஷன் பயோமெடிக்கல் ஸ்பெஷலிஸ்ட், ஹாஸ்பிட்டல் பயோமெடிக்கல் இன்ஜினியர், டெஸ்டிங் அண்ட் குவாலிட்டி பயோமெடிக்கல் இன்ஜினியர். இதுலயே வந்து பாத்தீங்கன்னா ரெகுலேட்டரியும் உள்ள வந்துடும். அண்ட் தென் பயோமெடிக்கல் கன்சல்டன்ட், பயோமெடிக்கல் கிளினிக்கல் இன்ஜினியர், பயோமெடிக்கல் ரிசர்ச்சர். ஸோ இதுல எங்கேயாவது கோடிங் வருதா பாத்தீங்களா? Because coding is not at all a biomedical job scope. Please remember, guys. Please remember. So, sales biomedical engineer. For example, if you are appointed as a sales biomedical engineer, the qualities line there, of course, you have a capability to speech. You have a capability to be a patient. ஏன்னா டாக்டர்ஸ் நம்ம பார்க்க போறோம் அப்படின்னா டாக்டர்ஸ் அவங்க பேஷண்ட்ஸுக்கு தான் ஃபர்ஸ்ட் ப்ரிஃபரன்ஸ் கொடுப்பாங்க. அவங்க கொடுத்ததுக்கு அப்புறம் ஒரு 5 minutes 10 minutes நமக்கு அப்பாயிண்ட் பண்ணுவாங்க. அந்த within a 5 minutes or 10 minutes, you need to elaborate about the equipment what you are going to sell. The doctor should be inspired about it. Then only the particular doctor get the equipment. Okay, then only you can able to get an incentive and all that. All the things happen. So adukku namakku enna quality irukano. At the same time, if you are appointed as a sales biomedical engineer in Philips, you should know about the particular product done by the other companies also. Because doctor கேட்பாங்க, நீங்க பிலிப்ஸ்ல இருந்து ஒரு எம்ப்ளாயி போறீங்க அப்படின்னா ஜியோட ப்ராடக்ட் அங்க வச்சிருக்கோம், அதுல எந்த மாதிரி ஆப்ஷன்ஸ் எல்லாம் இருக்கு அந்த மாதிரி கேட்பாங்க. ஸோ யூ நீட் டு நோ அபவுட் த காம்படேட்டர்ஸ் ஆல்சோ. அந்த பர்டிகுலர் எக்யூப்மெண்ட்டை காம்படேட்டர்ஸ் எப்படி பண்றாங்க அப்படின்றது யூ ஹேவ் அ நாலேஜ் அபவுட் இட். Then only you can able to face the doctors very clearly. And then service biomedical engineers, of course, you need to go for the troubleshooting the equipment, whatever the equipment it may be. Even though if for the surgery is going on, major surgery is going on, unfortunately the equipment is not functioning properly, then straight away you need to go and rectify the particular issue. So indirectly you are saving the life of the patient also. So that is the service engineer job. And an application specialist, you need to give the speech to the doctors. You need to explain about the demo to the doctors, knock on corners of each and every equipment. You need to explain about it. No need to dismantling about. but externally, the external parts and the recent trends and the recent advancement, what is there in the equipment, all the thing you need to explain about it. And some of the tier 3, tier 4 companies know they are fixing the sales biomedical engineer along with the application designation also. They is upon it as a sales and application specialist. Some of the biomedical company we can able to pointing out. I'm not going to pointing out because it is not maybe a serious issue. And then testing and quality biomedical engineer, and then by hospital biomedical engineer, the whole maintenance. Don't think that the hospital biomedical engineering job is very easy. It is a very it is a toughest job, one among that. Okay, and then testing and quality biomedical engineer, it is in the manufacturing sector. You are just a quality. If you want to be a testing and quality biomedical engineer, you should strong on the electronics and anatomy, because it is not a market job. It is not a healthcare market job. It is straight away in the manufacturing sector job. You are the once you're appointed as a testing and quality, you are the responsibility for the equipment. If the particular equipment gives some of the side effects, or if the particular equipment gives some of the ill effect to the users or the patients, then you are the responsible person. You need to approve the particular equipment to the market. You need to test the particular equipment before it went into the market. That is the most important thing you are need to know about. And then biomedical consultant. So in some of the biomedical companies, they are not straight away appointing the employees. Through the link only they are appointing. That the linkers are called as the biomedical consultant. They are giving training. They are giving training to the people. And then once the vacancy is there, straight away the tier 1, tier 2 company people straight away contacting the consultant. And then through them, they are connecting the jobs for the employees. Okay, and then clinical engineers, especially laboratory devices, and some of the kind of research oriented works is also done in the clinical engineers job. And then research and development, it is doing in the two different process. There is a separate research and development sector is available in most of the Indian funding agencies. They are having some of the research development sectors, and each and every some of the tier 1, tier 2 companies are also having the separate research and development sector. I hope so. You can't able to see the next to the consultant, it is a clinical engineers, and next to the clinical engineers, it is a researcher, biomedical research. Okay, so totally 8 job scopes are available. இதுல தான் ஏதாவது ஒண்ணுல நம்ம வேலை பார்க்க போறோம். ஸோ இதுல ஒண்ணுக்கு வந்து பாத்தீங்கன்னா roles and responsibilities entirely different for each and everything. At the same time, the duty, the requirement, என்னென்ன மாதிரி குவாலிட்டிஸ் உங்களுக்கு வேணும் அப்படின்றது வந்து பாத்தீங்கன்னா each and every job scopes entirely different. So all the things, I hope so your faculty members will discuss about that. So some of the leading biomedical companies, இதுல leading biomedical companies போடணும்னா நம்ம ஸ்லைட்ஸே பத்தாது. பட் இப்போ இருக்கிறதுல லீடிங்கா இருக்கக்கூடிய சில கம்பெனிஸ் I just pointed out: GE, Philips, and Siemens Healthineers, Drager, Stryker is missing, and Rocky Diagnostics also there, and Macvat, Medtronic, and then Alangis. And then all these biomedical companies are most important biomedical company. You need to note about it. Okay, I hope so. This is the particular thing I am trying to share through the Lavanya madam. So all these things, I hope so I covering all the points what is there in the title, recent trends and the job opportunities. So my kind request to all the participants, those who are participating here for the past 1.5 years, is try to know about the market as soon as possible. Try to know about the market as soon as possible. For that, you need to be connected with some of the companies. Through them only you can able to get what has happened in the market. Okay, so from my point of view, don't trust the pessimistic rumors. Okay, negative rumors வர்றத வந்து பாத்தீங்க அப்படின்னா you just please don't trust, because vacancies அப்படின்றது நம்ம கண்ணு முன்னாடி நிறைய இருக்கு. அதை எப்படி தேடணும் அப்படின்ற விஷயங்கள் தெரியாம தான் நிறைய பேர் ஜாப் இல்லாம இருக்கும். ஓகே, அட் த சேம் டைம் each and every job scopes we have a research. இந்த யூடியூப் சேனல்ல நம்ம ஒரு ரிசர்ச் எடுத்து போடும்போது most of the 70%, almost 65% of the biomedical employees, they resign their job within 6 months. Please remember, in India, especially in India, 60 to 65% of the freshers, they are just resign their job within 6 months. ஏன் என்ன காரணம் அப்படின்னு கேட்டீங்கன்னா, அந்த ஜாப் ஸ்கோப்போட நேச்சர் பத்தி அவங்களுக்கு முன்னாடியே தெரியல. Once you are getting to the market only, they know about what has happened in the market. அப்படி நம்ம போனோம் அப்படின்னா it is not possible to stay back there. Before you are entering into the job itself, during the final year itself, you know about all the job scopes clearly. என்னென்னலாம் தேவை, இந்த ஜாப்ல என்னென்ன அட்வான்டேஜ், என்னென்ன டிஸ்அட்வான்டேஜ், எதெல்லாம் நம்ம உடம்புக்கு ஒத்து போகும், இதெல்லாம் நம்மளால பண்ண முடியும், இதெல்லாம் நம்மளோட ஃபேமிலி சுச்சுவேஷன்ஸுக்கு இதெல்லாம் பாசிபிளா இல்லையா. ஸோ ஆல் திஸ் திங்ஸ், தட் இஸ் வாட் ஐ பாயிண்டிங் அவுட். All the job scopes have different roles and responsibilities. All the job scopes have different job requirements. Okay, qualities of employees entirely different இருக்கும். ஸோ அதெல்லாம் வந்து நம்ம ஃபைனல் இயர்லேயே தெரிஞ்சா மட்டும்தான் யூ டிசைட் யுவர் செல்ஃப், திஸ் இஸ் த எக்ஸாக்ட் ஜாப் ஸ்கோப்ஸ் ஐ எம் கோயிங் ஃபார். ஸோ என் ஃப்ரெண்டு ஜாபுக்கு போயிட்டா நானும் ஜாபுக்கு போகணும், ஏதாவது ஜாப் கிடைச்சா போகுதும் அப்படின்னு நினைச்சீங்கன்னா இட் இஸ் நாட் அட் ஆல் குட் வே டு சர்ச்சிங் த ஜாப். Be confident on your job scope. Be strict on your decision. Then only you can able to flame. Then only you can able to catch the tyrant. ஒரு 2 மாசம் ஆயிட்டாலும் பரவாயில்ல. மே மாசம் எக்ஸாம் முடிக்கிறீங்க அப்படின்னா it takes almost 2 months or 3 months ஆயிட்டாலும் பரவாயில்ல. Wait for the opportunity. And the opportunity search பண்றது ரொம்ப ரொம்ப இம்பார்ட்டன்டான விஷயம். How we can able to search the opportunity is also most important. We are not searching the particular thing as like as other people did through the Naukri or through the Monster, through the Times job or through the papers and all. We are not. நீங்க பாத்திருக்கீங்களா வெட்னஸ்டே வரக்கூடிய ஜாப் வேகன்சி ஹிந்துல அந்த மாதிரி நிறைய வேகன்சிஸ் பேப்பர்ல ஏதாவது டயர் ஒன் கம்பெனியோட பேப்பர் டயர் ஒன் கம்பெனியோட வேகன்சிஸ் பாத்திருக்கீங்களா பேப்பர்ல? Not possible. They are not giving advertisement to the papers. They are not having the அந்த மாதிரி அட்வர்டைஸ்மெண்ட் கொடுத்து எடுக்கணும்ன்ற அவசியமே கிடையாது. ஸோ அப்போ அவங்க எப்படி அட்வர்டைஸ்மெண்ட் கொடுக்குறாங்க? How we can able to search the job. So all these things, I hope so that is a possibility there. அதை பத்தி பேசணும்னா இன்னொரு செஷன் இருந்தா தான் we can able to say talk about that. So அந்த மாதிரி விஷயங்கள் எல்லாத்தையுமே through the faculty member, of course you are having a well equipped faculty member. I think so. ராமகிருஷ்ணா is எல்லாத்துக்குமே ஒரு குரு மாதிரி அவங்க. ஸோ அந்த காலேஜ்ல படிக்கும் போது faculty members are might know about all these things and all know. So you just get the inputs from there. Not only the technical as academics மட்டும் கனெக்ட் பண்ணாம faculty members இந்த மாதிரி விஷயங்களும் கனெக்ட் பண்ணீங்கன்னா you can able to get a knowledge about how to search the job, because the searching the job is entirely different from other sectors. That is the point. You once you know about that, எப்படி ஜாபை சர்ச் பண்ணணும், எந்த பாத் அப்படின்றத கண்டுபிடிச்சிட்டீங்கன்னா then you can able to get placed in tier 1 company very easily. So that is the most important thing I need to share. So I hope so, Lavanya madam, I hope so I covered all the points, right?
Yes, sir. Thank you, sir.
Yeah, it's a pleasure.
Thank you for this wonderful session, sir. Now I request our Biomedical Engineering Department Head Dr. V. Ramamurthy, sir, to share his view on this informative session.
Hello, it is over. Can I shut out?
Any queries? Any queries from student side?
Hello, good afternoon. Am I audible?
Yes, sir.
Am I connected?
Yes, sir. Yes, sir.
Hello.
Yes sir, you are in.
Okay.
Please. Yeah.
So I hope I'm online. I was actually not connected. So let me thank Mr. Aditya Pandian for sparing some of his time to share his experience and expertise on this area. Okay. So he mainly focused on how all of you need to be preparing yourself for facing the job market, and he also identified some of the very exciting areas where a lot of developments have come, right? So all I want to tell you is, I think most of what he said, I think you should have taken notes and follow it up. Okay, it is good that some experienced person comes and tells something, but ultimately your progress depends on what you are able to do, and he has just shown the light where you can sort of take steps and move. Okay. I think it'll be very helpful for you if you have some specific questions, so that he can address your concerns or your questions more specifically. I'm sure he will be able to spare some time for that. Okay. My side, I will say thanks for sharing your time and enlightening our students on the opportunities available to them. Thank you so much.
Thank you very much, sir. Thank you. It's my pleasure.
All right.
Any queries? Students, unmute yourself and you can ask now.
Santosh Kumar, do you have any clarifications? Do you have any doubts? Because through LinkedIn, you are asking so many questions. So why not you are not opening your mouth?
Okay. I think the chat box question can also be, told to him so that he can.
Yeah.
Sir,
Because I have a bad experience on WebEx, so that is what. I mean,
Sir,
it is possible. Can you read out the chat box? Yeah. Can you please read out the? Yeah.
Yes, sir. One of the students from third year. Can you say about brain-computer interface and its scope in India?
Brain-computer interface. Of course, it is not only in India. It is all over the job market. It is okay for the research and development. It's play a main vital role because still now we are struggling to interfacing that. So of course, that is a main important area we can able to target out. And most of the companies, especially tier 2, tier 3 companies, they are expecting this kind of the thing. Of course, it is okay, ma'am. You can develop yourself regarding the brain interface, and you can able to develop along with that particular AI technology. Then that is very most comfortable for you to adopt with the recent trends in brain interface, because brain interfacing technology is there in past many years, but nowadays they are connecting that particular thing into the AI and ML. So the most important thing is if you want to be flame on that particular thing, you just learn something about AI and ML, then that is most comfortable for you to take into the market and take it to the competitor. Okay, then ma'am, anything else?
Any other queries? Any other queries from final year students?
Or else if they are not if it is because of the group, அவங்க குரூப்ல இருக்கிறதுனால அவங்க பேச முடியல அப்படின்னா, you can able to give my mail ID also, ma'am. ஏன்னா நீங்க கிளியர் பண்ணாத நான் கிளியர் பண்ண போறது இல்லை, because we are all well equipped, you are all well equipped persons. So அதுக்கு மேல அவங்க ஏதாவது கேட்டாங்க அப்படின்னா, I will share my mail ID to you, and then you can able to share to the students, then straight away they can able to ask the questions through that also.
Okay, sir.
Yeah.
Any questions?
Since nobody is asking question, let me ask the question then.
Yes,
sir, நீங்க என்ன பண்றீங்க? What is your business? நீங்க ட்ரைனிங் பண்றீங்களா? ப்ளீஸ். யா.
எஸ் சார், நான் வந்து ட்ரைனிங், இம்ப்ளான்ட் ட்ரைனிங் கொடுத்துட்டு இருக்கேன். அது ஆக்சுவலாக கம்பெனியோட மெயின் இஎம்ஐ என்ன அப்படின்னா, இம்ப்ளான்ட் ட்ரைனிங் கொடுக்குறதா எங்களோட மெயின் ஜாப் சார். ஆக்சுவலாக ஃப்ரம் த 2017 onwards we are having this company actually, and we are training some of the students. அதாவது இன்ஜினியரிங் படிக்கிற ஸ்டூடெண்ட்ஸ் சென்னையில இருந்து ஈவன் நார்த் இந்தியன்ஸ் நிறைய பேர் இங்க வருவாங்க. we are providing some of the free accommodation also, and they are staying here for the almost 15 to 20 days, and we are having almost 45 to 60 biomedical equipments with us. So we are giving training to each and every equipment, which are all the trending la enna equipment irukko adella we are dismantling all the equipments, and we show what is happening in the inside part, and if there is any troubles irundhathu appadina adu eppadi வந்து நம்ம அதை டீபக் பண்ணணும் அப்படின்ற எல்லா விஷயத்தையுமே டாப் டு பாட்டம் we are giving a clarity about. 50 and the 20 days வந்து பார்த்தீங்க அப்படின்னா almost from 8:30 to 5:30 they are all be here, and then from the total 8 hours we are totally involving 2 to 3 equipments per day. அந்த எக்யூப்மெண்ட்டை பற்றின டாப் டு கார்னர் எல்லாத்தையுமே we teach them. At the same time we are connecting with some of the companies also, like in some of the companies, some of the tier 3 tier 2 companies in Chennai. ஸோ அந்த கம்பெனிலையுமே வந்து பார்த்தீங்கன்னா பிளேஸ்மெண்ட்ஸ் அப்ரோச் பண்ணாங்க அப்படின்னா நல்ல எக்யூப்டான சில பர்சன்ஸை வந்து we are recommend for them, and many almost 50 to 55 people's got placed in some other company. Of course, Logopriya, I told you, no, Medtronic, through them also we can able to place the particular person to them. So அந்த மாதிரி விஷயங்கள்லாம் பண்ணிட்டு இருக்கோம். அது ஆன்லைன் ட்ரைனிங், பிகாஸ் ஆஃப் த பேண்டமிக் பீரியட் we started introducing ஆன்லைன் ட்ரைனிங் from 2021 itself. ஸோ அதில் வந்து ஆன்லைன் ட்ரைனிங்லேயுமே வந்து பார்த்தீங்கன்னா 10 days of training we are covering only 20 equipments. Still we are going for 20 important critical care equipments. ஸோ அதை நம்ம ப்ராக்டிக்கல் எக்ஸ்பீரியன்ஸ் இல்லைன்னாலும் என்னென்னலாம் எங்களால் ஷேர் பண்ண முடியுமோ அந்த விஷயங்கள் எல்லாத்தையுமே we are supposed to share the particular thing to the students. ஸோ இதான் நாங்கள் ஓவரால் பண்ணக்கூடிய விஷயம் சார். Full and full it is a training spot.
Thank you so much.
Yes.
Yeah, I think just for the purpose of clarification to the students, I just asked this question.
Yes.
Yeah, I think
Yes,
it's
sir.
very important that students realize that at least
Yes, sir. If it is possible, see the website www.athinapondian.com. This is my website actually.
Okay.
Just as the students to go and visit the particular thing, then they might get an idea about what has happened here in the company actually.
Okay.
Yeah.
Thank you so much.
Yes, sir. Anything else, Lavanya madam? I need to wait for anything else.
Any questions, ma? Okay, Sunan, we will end the session, Sunan. So I request Sunan to give vote of thanks.
Am I audible, ma'am?
Yes, Sunan.
So, a very pleasant afternoon to one and all. I am very happy that I have been entitled the golden opportunity for delivering the vote of thanks for this valuable session. Words won't suffice for thanking Mr. Athina Milagi Pandian for his valuable time and effort that he has spent for us, and also the knowledge he has shared with us. Thank you, sir. We all are forever and gratefully indebted to our respected HOD, Dr. V. Ramamurthy, to conduct this lecture. Thank you, sir. I also thank the teacher in charge of Bioelixir, Ms. Lavanya, for hosting this valuable session. Last but not the least, I thank all my professors and my friends for making this session a success. So I wish all of them to stay safe during this pandemic situation. Stay home, stay safe, get vaccinated, and thank you.
Thank you all.
Very much. Thank you to the management of Sri Ramakrishna, and thank you head of the department Hari sir, and thank you my colleague Lavanya madam, and thank you Mr. Santosh Kumar, who is inviting me for this particular wonderful session. So thank you very much. நான் நினைக்கிறேன் 1.5 hour யூஸ்ஃபுல்லாக இருந்திருக்கும்னு நினைக்கிறேன். நான் நிறைய பேர் டவுட்ஸே கேட்கல, ஏதாவது ஸ்ட்ரகிளான்னு தெரியல எனக்கு. ஐ ஹோப் ஸோ இட் மே. லாவண்யா மேடம், நீங்கள் ஃபுல் செஷன் இருந்தீங்களா? இட் இஸ் வெரி ஓகே, ரைட்? Yeah.
Yes, sir.
Yeah. Thank you very much, and thank you for the time, and thank you for your patience and everything. Okay, thank you very much. We'll meet later. Thank you.
Thank you so much, sir.
Yes, madam.